Hi, this is Dr. Christy DeSaffrey, founding physician of Bone and Body Women's Health. As many of you know, February is American Heart Month, so I wanted to talk today about menopause transition and what happens with cardiovascular disease. Many of us are familiar with traditional risk factors for high blood pressure, high cholesterol, diabetes, and family history, all affecting our heart disease and our risk for heart disease like heart attacks, strokes, etc. However, did you know that menopause is actually a risk factor for heart disease? And the American Heart Association back in 2020 published their guidelines, which is very important. That's reached all the cardiologists, this reached internists, gynecologists, and it's important because they mentioned that just going through menopause and being a female is a risk factor for developing cardiovascular disease. And we know this from our scientific literature. We know that when estrogen, which is a nitric oxide vasodilator of our arteries, when we lose estrogen, we have more increased resistance in the arteries, hardening of the arteries or atherosclerosis, increases in vascular resistance, pushing up the blood pressure, and even glucose intolerance or insulin resistance, which increases the risk for diabetes or prediabetes. So all of these changes at menopause, which are dramatically coming from the loss of estrogen or estradiol particularly, can put us at an increased risk for cardiovascular disease as a whole. So yes, it's important to know your family history. Yes, it's important to follow the Mediterranean lifestyle, get adequate exercise, know your cholesterol numbers, understand what your diabetes or hemoglobin A1C measure is. But important to know that your time at menopause, whether it's early menopause, surgical menopause, natural menopause, everything will change in your cardiovascular system at that time. We know from many great studies that women who undergo early or premature menopause, particularly earlier than age 45, have a doubling of their risk of atherosclerosis or cardiovascular disease compared to women who undergo natural menopause in their 50s. So really important to understand that estrogen impacts our cardiovascular disease, impacts our risk of cardiovascular disease. And when we think about estrogen replacement, hormone therapy, when it's indicated, we know from studies looking at women who have received hormone therapy, estrogen plus a progestogen, either oral estrogen or transdermal estrogen, who have indications and no contraindications and receive a progestogen if they have a uterus. We know that starting estrogen early in the early perimenopause, menopause transition, or within the 5 years subsequent to menopause, compared to women who started estrogen later, maybe 7 years after their menopause transition. Women who started estrogen early had lower risks of our cardiovascular disease markers, such as looking at the carotid artery intimal thickness and other indicators that we look for to assess cardiovascular risk. So important we look at women's health overall and globally. We know cardiovascular disease is still the #1 killer of women. We have a lot that we can understand that menopause is a significant risk factor for cardiovascular disease, and we have to keep this all in perspective, more thinking about women's health from a global perspective. I hope to see you soon.